There are people in the operating room who never went to medical school. They're 22 years old and they're telling your surgeons how to operate. I was one of them for nearly 8 years. For almost 8 years, I sold surgical implants and instruments in the operating rooms. Then I moved into global strategic marketing. 5 more years inside the industry, but on the other side of the table, building the products, pricing them, deciding what gets brought to market and what doesn't. In total, I scrubbed into somewhere between 12 and 15,000 surgeries. I taught surgeons, fellows, and residents how to do procedures. If that sounds insane to you, that's because nobody outside this industry talks about it. Today, I'm going to tell you exactly who these people are, why they're allowed in your surgery, and what they actually do once that OR door closes behind them. They're called medical device sales reps, salespeople. That's the part that breaks people's brains for the first time they hear it. The person standing 3 feet behind your surgeon advising on which implant to use, a salesperson. But hold on, because the picture is more complicated than that. Most reps come from one of four backgrounds: business school grads, biology majors, former college athletes, or career switchers from nursing or healthcare work. I was a college athlete and bio major who went into business. My first day on the job, I was 22 years old. Now, before any of us are allowed within 50 feet of a patient, we go through this: hundreds of hours of product training, anatomy training, often taught by surgeons themselves. Cadaver lab, where we personally perform the surgery on cadavers with our own hands before we ever touch a real case. Background checks, drug testing, HIPAA training, sterile aseptic technique certifications, hospital credentialing through services like VendorMate or RepTrax. And one more thing people don't know: patients sign a hospital consent form consenting for vendor reps to be present in their case. Every hospital has a vendor policy. So when you hear someone say the patient had no idea, they did. They signed for it. They just didn't know what to expect because no one explains it to them in plain English. Here's the part that sounds the craziest: surgeons need us in there. How does a surgeon not know how to do surgery? They do. They went to medical school, they did residency, they did fellowship, but the technology changes constantly. Every year, every quarter, there's a new implant, a new instrument, a new technique. 5 different companies are competing for that surgeon's case, and each one has slightly different way of doing a procedure: different drill bits, different anchor designs, different software on the camera or robot, different sequence of steps. A surgeon doing 8 cases a day, 3 days a week, can't keep up with all of that. That's our job as a rep. Think of us like a caddy. A great caddy knows their golfer's swing, their distance off the tee, where their ball flight breaks, what they're feeling on a given day. They know the course better than the golfer does. Every bunker, every slope, every line. A great rep knows their surgeon the same way. We know how they hold their instruments. We know their preferred trajectory. We know their cases that gave them trouble last month. We know what they asked for before they even asked for it. So now let me take you inside one specific case so you actually understand what it looks like. You're frantically pulling on the worst pair of blue pajamas in a smelly hospital locker room. Cap, booties, mask. You're late. The surgeon is already scrubbed in. The patient's already on the table. It's the first time this surgeon has used your products. You crack open the door just enough to slip through. Air contamination is a real thing. Pressure differentials matter. So you move quietly. The patient is filleted open 8 inches across the shoulder. The surgeon is doing a hemiarthroplasty on a patient with avascular necrosis, meaning the head of the humerus. The ball of the shoulder joint has lost its blood supply. The bone is dead. It looks like cottage cheese. You walk through sizing for the replacement component. You're standing 3 feet behind the surgeon watching them work, and then it goes sideways. He's reattaching the subscapularis. That's the tendon you have to detach to get in the shoulder. And the suture anchors keep pulling out of the bone. The bone quality is too poor. The anchors won't hold. He turns around, not to me, to the other rep in the room, the competitor whose product he was trying. What am I supposed to do here? What are my options? The competitor freezes. I don't know. Let me make a phone call. Time is ticking. The patient is open. Anesthesia is running. Every minute matters. I step forward. Doc, what are your thoughts on underpunching and oversizing the anchors? We can compact the bone and create a better bite. He looks at me. He knows me. We've done dozens of cases together. The nursing staff speaks well of me. The scrub tech and I have a rhythm. Reputation is currency in the industry. Mine is the reason he listens. He nods. Let's do it. I turn to the circulator and tell her exactly what trays to pull. I tell the scrub tech the next 5 steps so they can stay ahead of the surgeon. He drives the anchors in. You can hear them squeaking as they thread. The sound is good. That's the sound of compact bone biting back on the threads. He finishes, closes, scrubs out. He pulls his mask down and looks at me. Those weren't even your products. I'll never forget that. That's one case. Sometimes the rep is 22, sometimes 50. Doesn't matter. What matters is this: the great ones know their products and their competitors' products. They aren't in the OR for commission, they're in the OR for the patient on the table. Because everyone in that room, surgeon, anesthesiologist, scrub, circulator, rep, has one job: the patient. The reps who don't understand that don't last. The dynamic is simple: help surgeons help their patients. Be honest. That's the whole game. If this is the kind of stuff you want to know about, how the OR actually works, subscribe. I'm running this channel for a long time. Next episode, I'm telling you what gets a rep permanently banned. Some of these will surprise you. A couple of them I've watched happen in real time.